Graduating from nursing school is a quiet, orderly achievement, but stepping onto an active hospital floor is loud, fast, and entirely unpredictable. The anatomy, pharmacology, and procedural steps you spent years studying represent the absolute baseline. They are the essential clinical sciences required to do the job safely. This illustrates the workplace readiness gap. On one side, pure clinical science. On the other, complex hospital reality. This gap is exactly where you must de-escalate family conflicts, navigate legal documentation, and manage decision fatigue. Simply passing your exams secures your medical license. However, mastering the human friction of the ward is what actually secures a survivable career. That is why the GPPAE Nursing Professional Training section exists. It acts as a structured bridge over that readiness gap. The core thesis of the program is highly specific. We take a technically qualified graduate and systematically transform them into a confident, functioning professional. This diagram maps out how that bridge is built. It relies on a hidden curriculum of 8 distinct modules, categorized into 3 phases designed to help you navigate every stage of career survival. Professionalism is often treated as an innate personality trait you either have or lack. In reality, it is a learnable, engineered system. Professional survival begins long before your first clinical shift. It starts in the interview room. GPPAE trains nurses to articulate their exact value, answer panel questions clearly, and face hiring managers with a specific type of engineered confidence. This comparison illustrates the immediate psychological impact of a strong first impression. The hiring manager is searching for a candidate who projects trust and discipline under scrutiny. Mastering your interview preparation wins you the job and proves you possess the baseline communication skills necessary to earn a patient's trust. Once you have the job, the focus shifts to the active hospital floor, where your clinical skills must pair with operational teamwork. Through the communication and teamwork modules, you learn to coordinate care safely among a diverse medical staff and interact respectfully with highly stressed patients. This loop maps out the internal engine for making responsible choices under pressure. By combining the nursing process with critical thinking, you can rapidly process stress factors through a strict cycle of assessment, planning, implementation, and evaluation. At the same time, maintaining your professional appearance and behavior acts as a nonverbal tool to project authority and maintain order in the room. Combining rapid, structured decision-making with strong interpersonal communication turns a chaotic shift into a predictable, manageable process. Beyond the bedside, there is an unseen administrative layer of nursing that protects the entire organization from liability. In an evolving healthcare environment, the professional ethics and lifelong learning modules provide a reliable moral compass when protocols change. This ties directly into legal and regulatory compliance, requiring strict adherence to documentation and patient confidentiality. Understanding hospital law and ethics protects the patient's physical and legal safety as much as pulling the correct medication from the pharmacy. This visualization maps a hospital's macro system, driven by individual staff microactions. As GPPAE training scales, professional discipline creates a ripple effect of coordination, leading to greater workplace productivity. This systemic efficiency creates a direct outcome: safer, higher quality patient care. It is time to stop preparing only for your next interview and start preparing for your entire professional journey. Join the GPPAE Nursing Professional Training section and become the indispensable professional asset that healthcare organizations are looking for.